Welcome to the LCFD Academy. You will get the following certifications. Let's start with the basic tools: cutters, spreaders, chainsaw, ladder, pipes. So we follow the 2 in 2 out rule. Always stick together. So that's how to do a house fire. Any questions?
Nope.
Okay, now we will go over car accidents. Actually, we should do EMS first.
Whoa, thanks for giving back my hair. Oh, I guess I'll have to change back to this. Back in this uniform. Where did he go? Oh, he is laying on the ground? Well, I am super laggy. Oh, he got up on his own. Looks like we are in the training room again.
So before we start, do you know what EMS stands for?
Oh, I'll give you 5 seconds to think about it.
If you don't know, that's okay.
I think it's emergency medical services.
Yes. So we are ALS and BLS providers in the county. We don't have enough people to run ambulances right now, but the engine is BLS and ALS fitted. I will teach you BLS today. Let's go over basic circulation. We'll go over bleeding and cardiac stuff. So bleeding, it's very bad and can lead to shock, and shock causes death. We are trained as EMTs and paramedics to stop bleeding on patients. If a patient is bleeding on a limb, apply a tourniquet. If it still bleeds, apply another. If there is bleeding on the abdomen, use loose pressure with a gauze pad or an abdominal pad. For chest injuries, wrap it in plastic material to prevent air going into the lungs. For head injuries, wrap it in a gauze pad. Any questions?
No.
We will now go over cardiac emergencies. There are 4 rhythms that are dangerous to a person. P, asystole, V-tach, V-fur. We have heart monitors for any cardiac situation. Because you are an EMT, you will be trained on CPR and defibrillation. I will grab an AED, please wait here. So this is an AED, aka a heart monitor. It is used to monitor a patient's pulse, shock patients, and heart rhythms. Remember this: if someone isn't breathing, unconscious, and doesn't have a pulse, start CPR immediately. After 30 compressions, you can use a BVM, which we'll talk about later.
Oh no, my battery is low. I hope this will end soon before it gets too low.
Sorry, I went AFK for a sec.
It's all right.
So that's cardiac stuff. We also respond to diabetes. If someone has low blood sugar, we have a medication called glucagon. That's basically it for that. So on your initial check for a sick patient or someone with a breathing issue or a cardiac issue, remember ABC. Airway, breathing, circulation, airway, can they breathe? Breathing, are they breathing? Circulation, do they have pulse? If so, what is their pulse? Now we will go into basic airway management. If someone is unconscious, you open the airway by tilting the head and lifting the chin. If they are in a traumatic situation like a fall or a crash, push on the jawbone to open the airway. Some items we have for airway management are OPAs. OPAs are used on unconscious patients to open an airway and provide better oxygen with other tools. And NPAs are used on conscious patients. For the same reason, there are 4 oxygen tools that we use. First, the nasal cannula. It's placed over the ears and into the nostrils. It's used for people that don't show signs that they have trouble breathing. We then move on to a non-rebreather, which is used for patients that are having a respiratory emergency. If that doesn't work, we move on to CPAP. But we don't really use CPAP that much. BVM, or bag valve mask, is used for unresponsive patients. It requires someone to squeeze a bag that forces oxygen into the lungs, in a way of breathing, kind of. So I will now go into splints. They are used to help with broken or dislocated limbs. For broken ribs, tell the patient to take deep breaths and help them with oxygen if necessary. Broken hips are typically known to shorten one leg. We also know how to identify brain injuries, tests of motor and visual movements, if one eye is sluggish or bigger than the other, as well as motor response.
I wonder what's that?
So that concludes our EMT training. Someone else is gonna come in shortly for a
Okay.
simulated patient. Any question? Oh,
Let me change real quick.
he's a skeleton.
Whoa, I am very impressed with his changing speed.
This is CAG.
What happened to him?
He's the second in command.
Oh, the power of magic brought him back.
Hello.
Hi.
I am the Deputy Commissioner. Thank you for joining us today.
You're welcome. Thanks for hosting this training.
He will be our simulated patient. Also for trauma, inspect the patient for any fracture like broken ribs or broken limbs and head injuries, just like we trained. And for trauma, use a C-collar and a backboard. Call will come out shortly.
Engine 1, respond to a fall near the fire department.
All right, we will get the truck first. The truck is not here, that means it outside. Oh, it's not this side, that means it on the other. Oh, I was right. Oops, wrong door. Oh, it stopped.
Black male, black shirt, black pants, cowboy hat.
Oh, no wonder he stopped the vehicle.
Hello, sir, can you hear me?
Help.
Do you feel dizzy or anything?
I hit my head pretty hard. It hurts and I was dizzy, but not anymore.
Okay, checks pulse.
70.
How do you fall? Like on your back?
I fell back and hit my head.
Checks head. Do I see anything?
Blood.
Patches up with 4x4 gauze pad. Creeper check to see if he's got a brain injury.
Not gonna lie, I kinda forgot what he teaches already. Okay, totally not. I don't know why I said that.
If his eyes are unequal size, as well as motor response.
I don't think there is.
Okay.
Okay.
Checks body for other signs of trauma. Is there anything else I see?
None.
Checks breathing. Are you breathing normally?
Normal breathing.
Checks blood sugar.
Normal.
Applies trauma collar. Creeper grab the backboard.
Oh, I forgot that I can't access the compartment. Perhaps there is one in my inventory? I have to go back to the station to get it.
Pretend to grab one for now. Sides under patient.
Got the
Puts
black
blocks
board.
to secure head in place. Straps down on backboard. Calls county ambulance.
Wow, really, it really came at the right time.
In scenario. Now we will go back and another call will go out. You will be
Okay.
in charge this time.
Oh no, I think it's like a small test. Wow, his driving skills is quite good.
Engine 1, respond to a fall near RC Bank. 20-year-old, black male, black shirt, black pants, brown cowboy hat. Suspect tripped on a rock.
Hello sir, can you hear me? Oh no, well my battery hears me.
Help me.
Checks breathing.
Normal.
Sir, is there anything you're not feeling well with?
What do you say? Sorry.
I mean, do you see anything?
Yeah. And see your hair.
Oh, it is blurry or there is something.
No.
Okay. Checks legs and arms.
Road rash. But other than that, it's fine.
Takes backboard, calling the ambulance. Citing backboard, carries the patient to the ambulance.
In scenario. Pass.
Oh, thank you.
I will
Okay.
talk you through. Always remember ABC airway, breathing, circulation. You didn't check the pulse. You didn't check blood sugar. You checked for brain injury and stuff. But just remember the pulse and blood sugar.
Okay.
Now we're on the last part. Car accident training.
Sadly, I will have to split this again to part 3. Cause of my battery that day and it would be quite long. It continues so it may be on the next video. Original timing. You know, have a wonderful day. See you on part 3 when it's out.